Well, I'd like to welcome everybody to the Medical Marijuana and Wellness Seminar Series. Tonight's topic is pain management and medical marijuana. This is a subject that's very popular, obviously, and we'll talk more about it. And more importantly, it's something that a lot of people, whether you're young, in your midlife, or basically as seniors, it's something that's a hot topic for you, especially if you have pain. I know I do, and I'll be talking about some of the medical cannabis options that are available to you and how it can help you and how it works. Uh, Tonight's presentation, I have a co-host who's had some experience in the market. He works for a company called Move, and I'd like to introduce you to Noah Shaw. Noah, tell us a little bit about you. Let me get off the screen share here. Sorry about that. Let me get off the screen share here, and let me introduce Noah Shaw. So Noah, tell us a little bit about you and what do you do?
I appreciate the intro and thank you for having me again, Mark. Just like Mark was saying, my name is Noah Shaw. I'm with Move. I've been with them going on about a year and a half now. I've been in the industry about 4 years. I actually moved out to Cali for about 2 years to learn it from its origins in the US anyway. And since moved back, been part of Move and part of the movement, and I like where it's going in Florida. We continue to have the support from people like yourself, Mark, and we continue to change lives every day.
Great. Well, as I mentioned to everybody when I begin the series, the reason we do the medical marijuana awareness series and medical marijuana and wellness webinars is our goal is if we can help one person tonight get their life back. What we mean by get their life back is we can help them be able to understand that medical cannabis is an option. And if they pursue that, be able to use it and be able to get as close to a normal lifestyle as they can, then we think we're being successful. Obviously, with a lot of conditions, this is not magic wand. It's not even fairy dust. It's something that really helps you. And you may not get a complete recovery, but it's something that if you can go back to living a normal life or pretty close to a normal life, that's our objective. Our objective is here for you. And I say that because our goal is also to be able to answer any questions you might have. So if you look at the bottom of your screen, you'll see a little, it looks like two little ovals. It says Q&A. Please feel free to ask questions. Noah and I are here to answer your questions. We'll have a slide deck that we'll go through that will explain a little bit about pain management and medical marijuana, but also it'll give you a chance to come up some questions and be able to provide some information. There's a chat button also. Sometimes people use the chat. We prefer you to use the Q&A. It's easier for us to monitor, but it's something that's definitely out there. But please feel free to join us, and please feel free to ask questions. That's what we're here for. I do want to go over to a slide presentation that I have, and the reason for that is because I have just a few slides to be able to prompt what we're doing. So I'm going to kind of get going on this right away. I have some what I call some housekeeping things I need to do. I thought I'd let you know that everybody, that tonight's webinar is being live streamed on Facebook. So if you have a Facebook account, you can go out to, as you can see, Marijuana Med Aware and be able to find our account and um, be able to link up to us. We have some webinars, as you can see on the right. Today's pain management. Next week we're doing multiple sclerosis, and then we're going to be doing ketamine after that. Now, I would like you to know that we are going to be doing webinars over the summer and actually for the rest of the year. We're finalizing our webinar series for next quarter. I know on the 17th of July we'll kick it off. 17th of July we'll kick it off. I'm sorry, 14th of July we'll kick it off on that Wednesday with dosing, which is a very popular webinar. So that one is going to be coming up. We'll publish that schedule probably in the next within the next week as to what we're going to be doing, not only this summer but also next fall, because a lot of people want to be able to see what's coming on in the future. I do want to point something out. We've had some people scam us. Some people have been trying to charge people for tickets to go to these webinars. These webinars are at no cost to you. They're free for the patients. And so please don't fall for one of those. Don't give any. We do not ask for your payment information. We do not ask for your credit cards. We do not ask for your personal information. We do ask for email so we can communicate with you, but we just thought to let you know that if you do receive one of those and you see that, please disregard it. That is not from us. We're trying to stop that as much as we can. But I guess if you're successful with the seminar series, what you're going to do is you're going to end up with some problems. Also, you're going to receive an email after this webinar. That email will give you a copy of the presentation, a copy of the video, and also the resources that are there. And this is what I was talking about earlier about the people that have been scamming us. And we apologize for that, but please don't fall for that. But please, definitely don't provide any financial information to these folks at all. That's not what we're looking for. We're here to provide you information and help you, and we'd like to keep it that way. So enough of the background information. Let's talk about pain. So before we start, let's get a baseline of what is pain. Pain is persistent pain is probably the most common patient complaint that we see. By the way, this is not just for medical cannabis. It also has to do with doctors. If you go out to a number of doctors and you ask them about what they normally treat, pain is usually number one on that particular list. What's really interesting is chronic pain is often misdiagnosed and mistreated. When I got in this industry 8 years ago, I dealt with a number of doctors who actually told me that chronic pain didn't exist. You know, I had it, and they said, "Well, maybe you think it doesn't exist, but I'm one that have it." And really, it's really a matter of what chronic pain is, and I'll talk about that in a moment. It is more than one condition in your body that's causing pain, and so it's very hard for doctors to diagnose it because a lot of doctors want to have one problem, one pill, and so they're trying to look for the one problem. But if there's 2 or 3 problems that are contributing to the pain, it's very difficult for them to diagnose, and that's what's happening. So in the meantime, people are left undiagnosed and candidly untreated and still living with that pain. So that's why we want to address what we're addressing today. I just want to talk about some of the background of pain. So what is pain? It's an unusual sensory or emotional experience. It's associated with damaged tissue, for example. If you hurt your arm, if you break your leg, or something like that, it has to do with that. So you can have some sort of a trauma-based pain. Also, you look at pain, and it's also based on what we call brain phenomena. Pain can come from emotion. It can come from PTS. It can come from anxiety. It can come from fear. People who become overwhelmed with stress do have pain. And so that's something that we also take a look at and put in the pain category. What's interesting is what are the consequences of this? The consequences are interesting because what we do is we get into a fight, flight, or freeze type of a mode. And pain is one of the things that really causes people to drop into those modes. And again, this has to do with the way our nervous system reacts. But if you see yourself in those situations, it could be coming from some sort of pain. Now, it doesn't have to be severe, but it has to be there. Let's put it that way. And also, pain can cause some heart rate, blood pressure, sweating. It has a lot of physiological responses to your body that's out there. So all of those things wrap in and fall into what I call the pain category that's there, and it's something that to deal with. I know that both Noah and I deal with pain, and we'll talk about more of that. But let's also categorize the 2 different kinds of pain that are out there. One is called chronic pain. So what is chronic pain? Chronic pain, as I mentioned earlier, usually persists and it comes for more than 3 months, and it's very regular in its reoccurrence. In other words, I'm a senior citizen, and as you get older, you get a lot of chronic pain. You get inflammation in certain areas that lead to pain. You get certain things that get hurt that lead to pain. You don't heal as well as you did before. And if you get 2 or 3 things that go into you that are affecting your body, like an inflamed knee, or maybe you bruise your shoulder or something, it leads to chronic pain. And those typically last for more than 3 months. It's something that's very hard to go away. And that's why doctors have a hard time diagnosing it. There's also what they call acute pain. Acute pain is where it's connected to some sort of injury or an illness, which is normally treated and classically goes away in a month or 2. So those are the 2 types of pains that are out there. What's fascinating is the chronic pain is the top condition cited for long-term disability here in the United States. And what was fascinating is that 3 years ago, it was not even recognized by a lot of doctors as being a medical condition. So what I'm trying to point out with this slide is if you have a chronic pain, or if you have pain, you're not uncommon. A lot of people in this country do, and it's something that they're all dealing with. Noah, tell us about where's your pain experience coming from?
Well, just getting older. Turned 37 this year. I know that might not seem old to a lot, but
You just know you're really getting old, man. We got to get you some crutches and things.
I know, right?
Senior citizens are looking really to help you out. You know.
Hey, I've been eyeballing them discounts coming up. But now majority of my pain comes from my lower back from a head-on collision I was in about almost 7 years ago. And what I did is I ruptured one of my lower discs. I want to say it was the L6. And I mean, I couldn't find anything to cure it. I mean, I've tried, different types of physical therapy. I mean, different types of pain medications. Like you said, uh, your pain relievers, like you get, more traditional ones like the opioids and stuff like that. They only last for so long. They're only meant for more short-term use. And I found that using medical marijuana supplements that pain, like where, for example, we got a patch that's a 72-hour transdermal patch. Whenever I have my long car ride days, I put one of those patches on my lower back, and it releases 0.24 milligrams of THC every hour. So it's not enough that it's going to affect your ability to do your day-to-day function. Uh, it's not within that, above that threshold, but it will relieve that lower pain as it does for me in my lower back.
Yeah. So you're dealing with back pain, which is something that's again common for a lot of folks, and especially for somebody, I'm sorry, I'm a senior citizen. I'll call it at a younger age. It's not a lot of fun to have to deal with. Let's talk a little bit about chronic pain and cannabis. Again, chronic pain is probably the number one reason why people turn to medical cannabis. What's interesting is what are the alternatives that people have in trying to deal with chronic pain? Well, if you're not looking at medical cannabis, then you're looking at something like opioids. And what's interesting is cannabis lowers the risk of addiction as compared to opioids. In other words, what you're finding is that the opioids are something that are addicting, can negatively affect your body, and it's something that can lead to death. And so that's something that's your alternative. And so cannabis is something that falls in a category where it's a lot lower risk. And I say a lot lower risk in that no one has ever died of a overdose of cannabis. The CDC has reported on this particular topic since they began in for over 50 years. And there's no one, both recreational and medically, that's ever died from using medical cannabis or cannabis in general. Now, there's people that have gotten high, there's people that have gotten, they've gotten nauseated and a number of other things, they've got sick, but they've never died. And I think that's important. When we're losing, what the government says is 22 veterans a day. Actually, that number is more like 52. The interesting thing is that we know that this is something that's, from the standpoint of causing something fatal, it's a lot safer for you. The other thing that's interesting is when you get involved with a lot of the pharma drugs, you're dealing with a lot of drugs that can hurt your kidneys, hurt your GI, and have long-term effects. And these are things that short-term will help you out, but long-term it's not a good idea to stay on them for, let's say, even more than a month, and definitely if you stay on them for a year or two, it's something that's really not going to help very much. Also, there's no issues related to liver damage. A lot of people have asked if there's problems from taking my current medication, and I also have liver issues. It's something that the studies have shown. That in case of cannabis, it hasn't necessarily hurt the liver and that type of thing. So we have some good evidence that it's a positive thing for your body that's out there. Also, it's also effective to not only treating just what we treat pain. What does pain equal? Okay, it could be ALS, it could be Parkinson's, it could be epilepsy, it could be PTS. There's a number of different things that it treats. Cannabis, you'll see the way it works, doesn't necessarily have to know exactly what the problem is. It just needs to know that it's there and what to do about it. Your body will self-regulate itself. And that's why a lot of states, in fact, most states that have a medical cannabis program, do in fact have cannabis, do have pain management and chronic pain as part of the qualifying condition that's out there. What's interesting is that a lot of patients look at cannabis as almost a last option. And I say that because it really should be one of the first options people look at, but unfortunately, they exhaust they go to the doctors, they go to the pain management clinics, they try the different pain alternatives for a while. Their body is telling them that this isn't right and this isn't cool. And so they try to look for alternatives, and that's where cannabis comes into play. And, I think for our culture and because of what we've gone through the last 50 years about cannabis being demonized, it's not uncommon. But it is something that to be aware that we understand that it may be a last option, but it is a good option for you. And there's also some other therapies that can be used to also help you relieve the pain. It's not just being able to treat the pain itself, but also exercise, stretching, things like that can help you alleviate the pain. So cannabis is something that helps pain. One of the things I will point out is that in many cases, if you have inflammation, the inflammation leads to pain. For example, I had my left knee replaced about 2.5 years ago, and that's a serious operation, and I get swelling from that. And when my knee swells, it gives me pain. Now I can say I have knee pain. That's one thing, but what really is it's the inflammation of the knee pain, the other knee that's causing the pain. So if I can address the inflammation, I can get rid of the knee pain. And I say that we'll talk about dosing later on, and that's a lesson that I learned in my dosing for pain is a higher level of CBD to address the inflammation. It's helped my pain management level quite a bit. But that's something that you'll see that's out there. Now, where does all the studies come from? Well, as we know, you're going to say, gee, cannabis is illegal here in the United States federally. It's called a Schedule I drug, which says it has no medicinal value at all. Now that's a whole discussion in itself as to why that happened. But in reality, a lot of people have realized that was just political, and it wasn't something that does not have scientific backing. And a lot of people have now gone out, and here in the United States, they've done studies. In the U.S., we cannot do research, but we can do studies. Most of the research on medical cannabis has been done overseas. It's been done in Switzerland. In Israel, in Germany, France, and a number of other places. So just be aware that those situations that's out there. Now, what clinical trials have we seen? We've seen clinical trials from the University of California, and what does that tell us? It tells us that basically subjects who are unresponsive to a number of standard pain therapies now find out that this, in fact, has been able to help them. They found out that there's from anxiety, and from the University of McGill told us that there's significant pain relief and sleep quality and anxiety with their particular patients. And then also there's another study that just came out in 2019 that showed that 80% of the participants found out, or basically stated, that using medical cannabis helped them from the standpoint of how useful it is. That's just the university studies. Let's give one testimonial. Noah, has it helped you?
Yes, sir. And that actually stands out to me. 80% of the participants found extremely helpful. I mean, that right there, 80%, I mean, it just really stands out to me. And yes, it has helped me with not only pain, but I tend to get, anxiety. That's one thing that I get a lot of questions about is, I have anxiety, and when I use medical cannabis, it gives me more anxiety. But that's when you get into the dosing and your different terpene profiles and stuff like that, which we'll get into later. But, you kind of, because of the lack of, information that we have here, because it's still a Schedule I drug, you kind of have to work with your doctor, your local dispensary, and just kind of come up with your own little regimen. Now, we can guide you the right way, but ultimately, you have to find out what exactly works for you. And to do that, the first step is to go talk to your doctor and see if this is an option for you. You get your medical marijuana card, and you can come see us, and we can kind of help guide you down that path too.
Sure. We will talk about that in just a moment. I'll talk about the dosing part of it. What I want to do right now is just have people feel comfortable from an efficacy standpoint that there are a number of studies that are out there. Here in the United States, we have something called PubMed. And PubMed is where all the medical research studies are held for the U.S. doctors to be able to look at what's out there. And PubMed has studies from around the world. Here in the United States, people may or may not know this, but the United States government has been funding research into medical marijuana since 1964. And I'm going to say that one more time. Your tax money and my tax money have been used to research medical cannabis since 1964. Now, how come we never heard about this? Well, because it was done by the U.S. Senate, because it was an illegal drug in the United States in 1964. They gave all the research grants to a scientist in Israel. His name is Dr. Raphael Mechoulam, and he's now considered to be the godfather of medical cannabis. Has made a number of wonderful discoveries over the years. Has actually 3 multi-billion-dollar companies that he's built. We built the whole Israeli medical marijuana business. And actually, he came back to the U.S. government in 2012 and said, "I don't need your money anymore. Thank you very much." And they said, "We still have it allocated, and we still give that money to the University of Israel and Ben Gurion University for studies. So I just thought I'd let you know there has been research that's done. And guess where all those research is stored? It's stored in PubMed. So I find it very fascinating when our legislators and people say we need more education, we need more research. My comment is, did you first look at our own research library? Because there's over 30,000 studies. Let me underline that. 30,000 studies on medical cannabis, when the most studied pharma drug that's out there, drug I'm talking about, has less than 2,000. And cannabis is not a drug. It's a plant that acts as a medicine. But there are subject areas like epilepsy that has 140,000 studies. That has to do a lot with not just the medication itself, but different conditions that are out there. But there's over 35,000 studies now about medical cannabis, and I point that out because it is effective. It is being studied. I wish that the United States would take it off the Schedule 1 list and do more research here. We clearly do a better job of research than any other country in the world, and we should really recapture our presence in the medical cannabis space. But I'm not being political. I'm just saying, just be aware that we tap a lot of the information I have. I tap into this information, and this is where we get what I call the straight scoop on medical cannabis. And that's where people like Move rely on this to be able to do their business. Now, one of the things we found is that there's a gentleman named Dr. Sanjay Gupta, and he's put together some wonderful programs and documentaries. He actually has 5 of them on weeds, part 1 through 3, and then he has weeds, part 4. And so he has some very good videos, and I'm going to recommend that you go take a look at them. These are links in the presentation, which you'll get, that'll actually give you the capability to actually see them. What I'm going to do, though, is I want to play a clip from one of those that I think is appropriate for this particular presentation. So let's take a look at weed 4.
THC, which is the psychedelic component of cannabis, which makes you feel high. And then there is CBD, cannabidiol, the non-psychoactive cannabis. We've told you about this one for years, especially how it stops chronic epileptic seizures in young children. There is also research showing that CBD is particularly helpful when it comes to pain. In fact, CBD can do something opioids cannot.
With opiates, you're talking about killing the pain, masking the pain, you're done.
Dr. Julie Holland edited Topical, a complete guide to cannabis.
With medical cannabis, you're actually not just talking about decreasing pain, but you're decreasing inflammation.
That's because opioids do a good job of interfering with pain signals going to the brain. With cannabis, works on 2 receptors, one that blocks that pain and one that decreases inflammation. What's ironic is that cannabis can do more than opioids, yet prescription opioids are legal and cannabis is not. Historically, that was not the case. For centuries, both cannabis and poppy, 2 plants, the natural forms of marijuana and opioids, were commonly prescribed by doctors and dispensed at pharmacies. But that all changed in the 1930s. Opioids would go on to become a best-selling drug, and cannabis became increasingly fringe. In part because one kind of cannabis, called hemp, was a threat to big business. Hemp is a cheap fiber, good for making paper and canvas, more absorbent than cotton, and could be used as a potential fuel.
So there were a lot of vested interests that sort of put cannabis down, took it away from the doctors, made it illegal.
So what's interesting here is that we had in the United States a thriving industry based on hemp and based on cannabis. In fact, up until 1937, you could buy hemp, you could buy cannabis and actually opiums in drugstores, and it was in part of what they call the U.S. The doctors had it as part of their pharmacology. About 30% of the remedies actually recommended cannabis. And there's a whole reason and a lot of things behind all that. I'm not going to get into that today. I just want to have people understand this is something that's been used for thousands of years, and it's used in a lot of countries. And it's something that is really been miscategorized. And I say that because we get fearful. I know when I grew up, I was told, stay away from the weed and do this and do that. And I think we've been told that we've been lied to, and that's one of the reasons I got into this industry. But what did Raphael Mechoulam, our friend in Israel, find out? He found out that we have in our bodies something called an endocannabinoid system. Endocannabinoid system is something that every mammal has. It's something in our body that helps us regulate our bodies. I don't know if you've ever heard or not heard of it, but typically it's a series of receptors. And those receptors are CB1 receptors and CB2 receptors that are inside your body. And as you can see, a lot of those receptors are used for a number of different things. The CBD, CBN, THC work what they call like lock and key in those human receptors to be able to manage things like pain, memory, appetite, inflammation, your immune system. The endocannabinoid system is actually comprised of both CB1 and CB2 receptors, and it's actually how your body functions to be able to help you with your health and your well-being. Now, CB1 receptors typically are located in your central nervous system and also in your brain. And those are the light blue ones that you see here. The CB2 receptors are typically found in your organs and also in your immune system. So these are throughout your whole body, and this is how your body basically manages itself. How does that exactly work? Well, what's interesting is that your body, your brain, will know if you have a particular problem. So, for example, if I have inflammation in my knee, my body will say that my nervous system will tell my brain there's a problem with my knee. My brain will then produce endocannabinoids and will send those endocannabinoids to that part of my body through the bloodstream to be able to address that particular issue. Now, let's take a person like myself. I'm a senior citizen, and I'm not producing the same number of endocannabinoids as I did when I was 25 years old. And so what's interesting is when I take cannabis, so you've heard of it as buds, tinctures, extracts, medical cannabis. When I take that, that goes into my body, and what it does is it naturally complements the endocannabinoids that my body produces. And so it now goes in, and those body receptors then are then used, they work together, and your body uses those to be able to, again, manage your appetite, your pain, your pleasure, your immune system, mood, that type of thing. I want to make you aware that there are synthetic cannabinoids. You probably hear a lot about those. I'm not a big fan of synthetic cannabinoids. I don't believe you can produce a banana or an apple in a lab or something like that. But there is one out there that's popular. It's called Mirinol. Do not use these products unless you are under direct and very close supervision by a medical doctor. These are THC only. They have a number of side effects. They are used effectively to address certain conditions, but I'd be very careful about those conditions just in general. But let's talk about the endocannabinoids and the photoendocannabinoids for a second. Let's talk about how they exactly work. What's interesting is your body, the endocannabinoids and the photoendocannabinoids are stored in what they call your fatty acids. They're stored in your body. They don't go to the CB1 and CB2 receptors directly. There's a lot of perception that it does that. It doesn't do that at all. What's interesting is your nervous system will say, gee, Houston, there's a problem. What's interesting is those fatty acids are then turned into long-chain fatty acids, and then they're distributed through your bloodstream to the part of your body to be able to address that situation. So whether that's been inflammation, whether it's been pain, whether it's gastro issues, this is how your body works. So this slide explains a couple of things. First of all, why has no one ever died? One of the reasons why is because it's your body producing its own medicine. This is not something that's foreign to your body. It's not something that's a drug that's out there. It's something that can really help. That's out there. People ask me to turn my mic up a little bit, so I'm going to do that. Let me see if that works a little bit. Tell me if that works a little bit on the mic. Thank you very much for the input. Now, the other thing that's interesting is the other thing that this shows is not only why nobody's ever died, but also it also shows why they have what they call the entourage effect. And what's the entourage effect? The entourage effect is where you take cannabis for one reason, for example, for inflammation of the knee, and what happens is I find that there's another problem that gets solved. For example, my mother taking medical cannabis she was diagnosed with breast cancer. This was almost 4 years ago. We put her on a regime of medical cannabis, and what's interesting is when she went to the glaucoma doctor, the glaucoma doctor told her glaucoma was gone, and she was a bit surprised. And he said, "What are you doing?" And she said, "Well, you're taking medical cannabis." And he said, "Well, it's not surprising. It's very good effective for that." So again, your body doesn't need a doctor's report. Your body doesn't need some sort of a test to be able to know you have a problem. your body will self-regulate itself if it's given the right material, which is what cannabis does. It really helps you with that particular situation. And this is kind of how cannabis works. It's something it's fairly safe. It is very safe. Now there are some side effects. You can get high, you get dizzy, that type of thing. But you're not going to die from it. That's the key part. Noah, any comments?
No, Mark, like you covered it really well there. I know, just like you said, you can't die from it. If you tend to overdo it, you might feel like you're going to die from it for a little while. But that's why it always goes back to just like talk about. Just you got to just kind of work your way into it. But no, like everything went over spot on.
Yeah. Well, and see, what's interesting is that it is something that is very natural. And so it's very different than the pharma drugs. This isn't take 2 aspirin and call me in the morning. This is something that you're working with your body, and you start, it's the regime that helps you over time be able to get better and be able to manage your body and your health. Now, when I got into cannabis, I got into the cannabis industry 8 years ago. I was not a cannabis user up until then. I actually got into the industry to help a friend, and all I ever heard about was sativa and indica. Noah, tell me about sativa and tell me about indica, and tell me why we don't hear as much about it as we did 8 years ago. So let's start with what is sativa and indica.
Yeah, we'll start with sativa. Sativa, it's just 2 different types of cannabis plants. Sorry, sativa is going to be tall in stature. It's got narrow leaves, a longer flowering cycle, better suited for warm climates. Your indica is going to be your more shorter stature, the narrower leaves. And when it comes to indica, the saying is indica out, and sativa is a more of an uplifting quality to it. So, but we're not just limited to those 2 types anymore. We've had what we call hybrids, and they could be more indica leaning hybrids, or they could be more sativa leaning hybrids, just depending on what you're looking for and what you need. So you can find what works for you, and a lot of times it is a combination of both. The hybrids are real, popular now. And me personally, I like the hybrids because it gives you the uplifting, but then it also gives me the more pain relief I feel like I get from the indica.
Sure. Now, what's interesting is, again, there was pure strains of cannabis, pure strains of sativa, the pure strains of indica. But what's interesting is today you don't hear much about that. What you hear is mostly about something called hybrids, which are really, again, I'm going to use a comparison to like a rose garden, where roses have been, cloned, and they put together different types of roses by being able to mix the plants together. That's basically what's happening today. Is as the dispensaries like yourself, the people that are making the cannabis, want to develop certain strains that address pain, that address gastrointestinal issues, that address arthritis, they're actually putting together these what they call these cannabinoids, and those are called hybrids. So why don't you explain a little bit about that? I know you guys do a great job in the hybrid space.
Yes, sir. Well, as I was touching on earlier, we have a few different options. The different types of hybrids. We tend to, to try to give a variety of different type of products to fit when it comes to it. Like I said, some of the hybrids are more sativa leaning, and some of them are more indica leaning. Like, for example, if you have like anxiety and things like that, you probably want to go with a more indica leaning hybrid opposed to a sativa leaning hybrid. And it all comes down to the different terpene profiles, how your body reacts to it. But there are a lot more options now than, like you said, just sativa and indica. That's all we used to hear about. Now, indica is really good for later in the day, sativa during the day, but you can find that combination. You can ratio that works.
You're bringing up indicas, and a lot of people use sativas in the morning, to get going, and they use indicas in the evening to kind of cool down. But we've learned a lot, especially the last 7-8 years, about terpenes, about how terpenes affect our body. We're going to talk a little bit about terpenes. The terpenes are really, really important in there, because the terpenes, which are on the cannabis plant, really the combination of those two give you basically the medical effect that the plant brings. Is that right?
Yes, sir. That's it.
So, and the other issue that's interesting is, and this is probably the most important thing to look at key to medical cannabis being successful is your dosing. And that has to do with how much you take, what you take, and when you take. And I say that because, unfortunately, this is not a situation where you take 2 pills and call me in the morning. It's not a pharma approach. Every person's body is different. So what you really have to do is you really have to come up with a dosing regime that addresses your situation for your particular lifestyle, the particular body that's out there. And you say, well, what? I don't understand it. Why is every body different? Well, let me give you an analogy. In certain cases, you have people that will go out, and you have friends when you go out, they have one drink and they're done for the night. I have a friend of mine that after his first martini, you tuck him away and he's done. I have other friends that can drink the whole bottle and they're just getting going. And a lot of that has to do with the way your body is. It has to do with your biology of your body and that type of thing. The same is true for cannabis. When you're in the alcohol world, you realize whether you can drink the light stuff or like vodka gin, or drink the dark stuff like vodka or something like scotch and bourbon. You realize whether you like an umbrella on it or not, that type of thing. Cannabis is pretty much the same way. You got to find out what your tolerance to THC. In other words, THC is very, very important to be able to help with the entourage effect and to be able to help with being able to bring the solution to your body, especially for pain. You need to have a certain amount of THC in your regime to be able to address pain. But you don't want so much that you get high and that it affects your ability, your motor skills, and that type of thing. So we typically start, and we'll talk a little bit about this later, about how do you find your sweet spot, and that's where we start and go low and go slow. We bring up with a 1-to-1. We try with 25 milliliters, twice a day, and do that for 4 or 5 days. See how that works, and maybe if that's not working, up to 50 milliliters, maybe up to 75.75 milliliters twice a day. Again, until we find where that tipping point is for where you begin to feel the euphoric effect from THC. Now, what happens when you do that, and you don't want to have that happen? What's interesting is CBD counteracts the THC effect. So what it's interesting is we always have people who are getting into medical cannabis have some THC, some full or broad spectrum CBD, around. So if you do start feeling that euphoric effect, just take some of your CBD, your pure CBD, and within a couple minutes, within 2 or 3 minutes, if not 20 minutes, it'll take you right down to where you want to be. So there's a way of finding this out without really going crazy or having huge negative effects. But again, this is where dealing with a medical marijuana professional and practitioners can help you quite a bit. And finding your dosing spot is really, really important. But in the meantime, let's talk about there's some subjects that come up. We hear about hemp and we hear about marijuana. Mel, what's the difference?
That's a good question, and I do get this a lot too. All right, when it comes to hemp, it's anything that's less than 0.3% THC. So your hemp plant, that's going to be your key difference. Marijuana is going to be anything over 0.3% THC. All right, when it comes to hemp, the common uses, but beyond medical and health issues, are like we talked about earlier in the video with textiles, hygiene products, paper, etc. And when it comes to marijuana, it has medicinal effects with the side effect of a higher dose being the high, that we normally describe from non-medical users. Okay, now as far as the appearance, hemp, it's a tall, lean plant, shiny leaves. Marijuana plant is more of a bushier. It's got the fuzzy buds.
Actually, hemp is kind of like a small little tree, not a big little tree. And marijuana is like, candidly, it's a weed.
And it grows so fast. That's why it's a big threat to a lot of the big textile companies back in the day. But the legality of it in the U.S. is hemp is fairly legalized for use in everyday products, whereas marijuana is medically legal in 33 states and recreational legal in 11 states. It's still illegal at a federal level.
Now the reason for that is because hemp basically is what we call an industrial product. You've probably heard of rope. There's a lot of bricks. I know that they're starting to make a lot of building material out of hemp today. And it actually stands up better to things like hurricanes here in Florida than concrete. Ford actually made a car out of hemp in the 30s. So it's actually a building material. And it's, like I say, it's a short, stocky bush that you see. The plants in it, the actual leaves that produce in there, do produce CBD, but it takes 8 hemp plants to produce a bottle of CBD, just to give you an idea. So a good high quality CBD product from hemp will be more expensive than a marijuana product because the marijuana product being bushy, you can produce more pure CBD and some CBD products from it. You need less, let's just say less bushes to be able to produce the same amount of products. So there's a difference between them. The main difference is if you're really looking at inflammation health, CBD is great, both hemp and medical marijuana versions. If you're going to address pain, I'll show you in a minute, you're going to need to be able to have some THC in there because CBD is okay at managing pain, but it's not what I would call the recommended way to go. It's not going to get you where you want to be. So let's talk about terpenes for a second. We kind of glanced over that really quickly, and we found over the last 3 to 4 years, this is one of the keys to really making medical marijuana work. It's one of the real keys to being able to make it effective. Noah, tell us about some terpenes.
Yes, so Mark, so the big question is, what is terpenes? Terpenes are the most common plant chemicals in nature, found in flowers, spices, fruits, vegetables, essential oils, etc. The terpenes, the way they work is your endocannabinoid system acts as the highway for the terpenes.
Basically your bloodstream is kind of the vessels throughout your body. That's the highway. It's tapped into that.
Yeah, yes, and the anandamida is the driver, and you look at the cannabinoid as the passenger, which carries the CBD and THC, and the terpenes navigate. It's basically like the GPS of your body, so it gets to where it needs to go.
Right. Yeah, the anandamide basically tell your nervous system says problem. The anandamide say, okay, we're going to take it to this particular part of your body. What does it take there? It takes the cannabinoids, the CBD, and the THC. But really, the terpenes really are what help shape it. It provides the relief. It's the thing that helps with pain management. It's the thing that helps with mood swings. It's the thing with anxiety and depression. It's the thing that helps with inflammation. And so they really home in on that. If people are familiar with essential oils, it's basically the same type of thing. They are very similar to essential oils. All of those have to do with their terpenes and essential oils that give it that life and that flavor. I kind of pulled up what I call the top 6. There are over 200 different terpenes in cannabis, but I kind of pulled up the top 6 that people tend to use and look for. And these are the kind of the ones that are available. Now you're going to say, I walk into a dispensary, I buy a product. How do I know the terpene is in there? And the answer, Noah, is what? Ask the bud tender because he'll give you the terpene profile of every product, right?
Yes, sir. Just for example, like limonene, you can find limonene. It works good as an antidepressant, anti-anxiety, antifungal, antibacterial, and you're going to find that in our strains, the modified grapes, the forum cut cookies, the purple punch. It's going to find the limonene in that. Limonene and pinene. All right, pinene is going to be good for anti-inflammatory. It's a bit of energy booster, improves focus, and you're going to find that in our banana hammock or Jack Herer or OG Kush, and we supply all the patients with the information what's in the product that they're purchasing.
Yeah, you get the product itself. It has some sort of QR code. It has on the side. You can be able to take your phone if you have a smartphone, put it up that QR code, and it'll not only tell you the terpene profile of that particular product, but it'll tell you the terpene profile of that particular batch right down to the product that's made. So you can find out exactly what's in the product that you're purchasing. Now, I know there's been a question that always comes up as to why doesn't people like Move produce a table that says here's the products with all the terpenes? And the answer is I know Move is in the process of doing that. And I've talked to some of your managers, and you'll be publishing that this summer. The biggest problem is when you keep bringing out a number of new products, just being able to finish that testing, get all the lab reports together and compile that has just taken some time, but you'll be able to find that as something that will be on the Move website this summer. But short term, if you're looking at buying a product, ask the bud tender at the dispensary what's in the product, or basically go in and say I'm looking for something with linalool or something that's looking at caryophyllene or something that's looking at eucalyptol, something like that in it, and they'll be able to bring those products out. They'll be able to show you what's there. I know that when I first got involved in medical cannabis, I had an auto accident. This was 4 years ago, and it left me with the ambiance of 2 herniated discs in my back and 7 herniated discs in my neck. What you never want to hear is those famous words from the doctor that says, "You're my PB, you're my personal best." I've seen 6 herniated discs, but never 7. The problem was when I got diagnosed, they gave me a bunch of pharma drugs that I literally, when I went home and took them, I couldn't sit on the couch. It was crazy. And I was in the medical cannabis business, so I basically got a prescription, and I was able to control my pain and be able to control my inflammation with medical cannabis. But when I went to the dispensary, the doctor made a recommendation when I went and saw him, and the dispensary personnel looked it up. And as you can see behind me, with all the little all the products that are there, you walk in, it's a bit daunting. It's the number of products. How did they know out of all those products which one worked? And the answer is real simple. Once he saw my medical condition, once he saw the terpene profile that was recommended, then he knew which products from that dispensary to be able to bring forward and to recommend to me. And it's actually a science. It's very much like a pharmacy. In fact, the future of cannabis is really going to be more of an apothecary than anything else. But the thing right now is they will be able to help you fine tune, really be able to dial in the products that you need to be able to address your pain and your inflammation. Anyway, did you want to talk about a few more? Can I take a few of these terpenes?
Yeah, go ahead, Marc. Sure.
Okay. And by the way, one last note on that my visit to the dispensary, there's a number of people who told me, listen, I'll just go smoke a joint, and if I smoke a joint, it'll take care of the problem. And probably if I smoked a lot of it and enough of it, it might. Okay, it's kind of like I'm going to go to a pool party, so what I'm going to do is I'm going to drink straight 151 Bacardi and just be able to get high. Yeah, you can get there. I'm not sure your enjoyment level is going to be that great. I'm not sure it's going to be you want to be effective, but it'll get you there. What's interesting is by being able to have the right terpene profile. For example, in my particular case, I can be able to take medical cannabis. I can be able to do my job. I can be able to lead my life and control my inflammation and by having less pain. Now, do I take THC? Yes, I do. And I take it in the levels that I know my body can tolerate. And I know that it's something that does help. I've been able to, without medical cannabis, my neck would leave me in the level of pain of a 7 or an 8 on a scale of 10. With medical cannabis, it's down to a 1. And that's a huge difference. And now I had to experiment with little things about what kind of products to take and what time to take and that type of thing. That took me about a month and a half to get it right. But once I did, I got my life back. I was able to do my job. I was able to do what I do. I know in my case, I have to be very, and Noah will tell you, I run a lot of websites. I run a lot of social media networks. I can't do my business high. I guess I could, but I'm not sure I'll be effective at it. But I've got to be able to be very lucid, and I've got to be able to walk and be able to be balanced in things. So it's important once you find your sweet spot, and you can, it's going to really help you. And I got my life back. But let me talk about a few of these other that are here. I know myrcene is one that's really effective. Myrcene is a very popular plant. It's one of the best pain relief and anti-inflammatories that you're going to see. I know that on this particular subject of pain management, myrcene is something that you really want to pay attention to. You'll find it in most products because a lot of products that address pain management are there. But myrcene is something that it's very interesting. It's actually much like lemongrass or basil or thyme. And what's interesting is you'll hear rumors, and it's not rumors, but there are people that actually eat mangoes when they take cannabis. And the reason for that is because the mangoes help, which have the myrcene terpene in it, complements what you're doing in cannabis. It's kind of like 1 and 1 is 3. It really helps with the pain management, and it really helps with the inflammation. But that's one of the most effective ones that's out there. Caryophyllene is interesting in that it's very peppery. It's very spicy. And by the way, a lot of people say, well, why did plants grow these terpenes? Plants grow these terpenes to be able to fend off insects, animals from chewing on them, and those types of things. It's something that's bad for the insect, but it doesn't hurt us. Put it that way. So it just had, and I get into. We did a terpene presentation about a week ago, and feel free to go back to our website marijuanaaware.com. Click on the follow-up tab. We can walk you through all the terpenes. But it's interesting how every plant has that as a protective mechanism, and that's a benefit for us. But myrcene is really, again, really good as an analgesic. It's really good for pain relief. A lot of topicals that you buy for pain relief Move has an excellent product for pain. It's a topical. It has a lot of caryophyllene in it to be able to help you with that. And I think the other one is eucalyptol, which is you've probably heard of the eucalyptus plant. Again, like bay leaves, like sage, that type of thing. It actually is, again, good for pain relief and good for anti-inflammation. I mean, I kind of picked a set of terpenes today to stay on subject with pain relief. But one of the things it does is eucalyptol helps decrease blood pressure. So if you have a blood pressure issue, get yourself a cannabis strain that has eucalyptol in it, and it helps you quite a bit. I know there's one option to be able to take a whole pack of blood pressure pills, and the other practice, look at some terpenes and some essential oils that will help you with that as well. It's probably a healthier way to go. I'm not trying to give you medical advice. All I'm trying to do is give you some options that you can take a look at. But those are kind of the main things that you'll find. And again, be aware that they're out there. There's also, if you take a look, there's 200 different varieties of terpenes, and we'll include a terpene profile wheel, a wheel that gives you information about terpenes in the follow-up material that's in the webinar. Now, we talked about cannabis, and this is what they call the famous CBD wheel. So what is this? This says that cannabis is made up of CBD and THC, but within the cannabis plants, there are some medical properties, there are some medical components that we've been able to identify. There's actually, right now, for your information, 450 different medical properties within the cannabis plant. This is just a few of them. Within CBD alone, medical marijuana-based CBD, there's 108 medical properties. In hemp-based CBD, there's 82 medical properties. So there are differences in how much these products can help you as you go along, but there are medical properties associated with them. And the cannabis plant is probably one of the most, in fact, it is the most prolific plant as far as bringing medical properties to the individual to help them. You want to talk a little bit about the CBD wheel? Talk about how CBDs and the THCs work together to 1 and 1 is 3.
Sure. Yeah, Mark. Well, just like you're touching on, if you take a look at the wheel here, I mean, there's many different benefits for different types. You got your CBD that, to me, is going to get this more of your long-term fix. It's going to get into the joints. It's going to help for inflammation, help reduce those pain over time. Whereas the THC will give you the more euphoric, immediate relief. But I'm a big fan of the 1-to-1 that, you have that CBD over time. Like you said, you find your regimen, you get back to living your daily life like you can. When you look at the chart here, a lot of times you see, your Delta-9 THC reduces nausea, relieves pain, stimulates appetite. Your Delta-9 THCA is going to be a sleep aid. It inhibits cancer cell growth, suppresses muscle spasms. So you can see how each one of them, you can kind of pair them together to get the relief that you're looking for.
Yeah, I mean, what's interesting is a lot of people will use, for example, CBD-based products. And if you look at the little chart over here, and you look at the CBGA, it relieves pain. So you will get pain relief from using a CBD product, okay? But if you add it with a THC product, you look over here that you've got Delta-8 and Delta-9 that also help you with pain relief. In fact, they're better at helping you with pain relief. So in essence, 1 and 1, or you add to 1 and 1 equals 3. Okay, you've got more of a concentration on pain, both pain and with inflammation. There's a night and day difference between using CBD only for pain relief and using CBD with a little THC in it. And I say a little because, again, wherever your tolerance level is, once you find that, being able to do that will be able to help you be able to have a working life, but I wouldn't say pain free. But in my case, if I keep pain below a level of 1 or a 0.5 on a scale of 10, I can lead a normal life on a daily basis. And that's what's important. This is where putting these things together are very important. That's why a lot of people recommend medical cannabis as opposed to CBD. It has a lot more healing properties associated with it. And you'll hear this crazy term called whole plant. Use as much whole plant as you can, because the more whole plant that you use, although you're addressing your inflammation, you're addressing your pain, when you get the whole plant product, it helps you with your gastrointestinal system, it helps you with your joints, it helps you with your memory. It does a lot of more things than just the two that are out there. again, I'm getting you past the pharma approach of just one pill, one problem. This is something where you can take one product and it helps a lot of things in your body. Helps your body recover, and that type of thing. So anyway, the medical benefits are clearly there. I just wanted people to see that there's there's more to this than I'm trying behind the scenes. There's more to this. You don't necessarily need to get wrapped up into it to understand it. Again, talk to your medical cannabis doctor. talk to your dispensary, and they'll be able to help you with that. That's out there. So let's talk a minute about how you take it, because I know that when I got involved in the industry, I had this perception that, well, I viewed not everybody's going to sit on the front porch with a nice joint and smoke stuff. We've come a long, long, long way from those particular days. There's a lot of ways that you can take medical cannabis, and it really depends on what you like, what you don't like, what's convenient for your particular schedule. No, why don't you walk us through a couple of them? Like, tell us about tinctures, vaping, edibles. What's that all about?
Sure. Yeah, and I fully understand. And whatever works for you now, that can always change. Like me, I used to prefer the flower, which is smokable. It's dry flower, call it bud. People call it different things. But ever since I had a son, a 6-year-old, I feel like, I want to be a little more discreet. So I tend to stick to more like your tinctures, your edibles, capsules, things of that nature. Your sublingual, the tinctures. Now, this is what you're going to take and you're going to put it up under your tongue, absorb through the digestive system, the blood vessels in the mouth. All right, now, you're looking at an onset time of about 15, 20 minutes and a duration effect of 4 to 6 hours. Now, if you move into edibles, now here in Florida, we have something called soft chews.
Something on the tinctures that are important. The tinctures, when you put the cannabis under your tongue, it gets right into the blood vessels and it goes right into your body. It bypasses your stomach, and that's probably one of the most effective ways of taking cannabis is through the tincture approach. You put it in your mouth. Literally, after about 30 seconds, it should be absorbed in your body. You'll taste it for a couple of minutes potentially, depending on how you actually put it in your mouth. You'll feel something like in my particular case, when I take a tincture drop, it works in about 20 to 25 minutes. However, it takes about an hour for it to fully take effect. Okay, so it's not something that boom happens right away. So just be aware, but it does last 4 to 6 hours. So, for example, when I get up in the morning, on my bedstand is a bottle of tincture oil, and I take that tincture oil every morning to be able to address my pain. I mean, the herniated discs in my back aren't going to go away, and so I need to be able to have that pain management to be able to lead my day. So, tell me about some other options that I have as well.
Yeah, just going into the edibles. Here in Florida, we have to call them soft chews, but it's going to be your gummies, your hard candies, brownies, cookies, anything you can pick up with your hands and eat. Patients with this need to pay attention to the dosage and desired effect, because everybody's metabolism is different. So my onset time could be 10 to 20 minutes. Your onset time could be 20 to 30. And once you digest the soft chews, I mean, you're going to have those effects for 4 to 10 hours. Once again, depending on your body type and how it processes. Now, another option here is capsules. If you're more used to traditional medication, with taking like a pill form, we do have capsules. They take, once again, it depends on your body, but it's a good option for beginners. And you can look at an onset time of 1.5 to 2 hours with duration effect of 4 to 6 hours. Now get down to a couple of my favorites.
Well, I should point out what happens with the capsule is it goes into your stomach. The capsule is actually absorbed into your stomach, and so what's interesting is you'll lose about 25% of the product will be eaten up by your stomach. So that's why capsules, you need to take more milligrams when you're using capsules than you would if you're using tinctures, for example. Okay, and why does it take so long? It's because it's got to be digested into your bloodstream. Now, once it does that, it does take, typically it stays active for a lot longer time. And I'm going to go back to your edibles and capsules kind of work the same thing. Edibles have to be absorbed by your body to be able to to be able to be effective. Now, these charts here are based on standard, what I call cannabis products. Move and a number of other folks have products that actually are encapsulated technology that actually work a lot faster. And we'll talk about that in a little bit because their onset times and their effective times are a lot better. And that's one of the advantages of products like Move. But be careful. And I say be careful because everybody has the experience where they take an edible, it's been 10 minutes, they don't feel anything. So guess what? They take another one and then they take a third one. And typically after about an hour, all three of them will take an effect and they are having a great time. Okay. Now you'll definitely get a euphoric effect because you're overdosing. It's like somebody who takes a couple shots of whiskey and then they say they don't feel it. So they take a couple more shots until the point where the shots start kicking in, then they're really going to feel it. So very similar. It's very, very similar. So just pay attention to that. But capsules, edibles work pretty much the same as far as being absorbed into your body. Tinctures go right into your bloodstream, which is very effective. Now you also have topicals and inhalation as an option, right?
Correct. Yes, sir. And that's getting to know one of my favorites is the tropicals. Now, when you get there, like I said, we have two different types. One of them does not have the encapsulation technology. It's more of a localized treatment. To say like if you got like build up arthritis pain in your hands, joints, stuff like that. It's good for a little quick relief in a specific area. Now, if you get into our products that have the encapsulation technology, it will penetrate the skin. It is water soluble, so it will get into your bloodstream. So you will feel the euphoric effects, where the traditional tropicals that we have and a lot of the competitors have too, you won't get that euphoric effect. It's just going to be a more localized treatment.
Sure. The topicals are very, very effective. I say that because, like when I had a knee operation, actually with my neck, if I start having some neck pain, I can put on a topical, and literally, now I happen to use a Move topical, which I love because of the fact that it has that transdermal effect. It gets right into my bloodstream, and literally within a few minutes, I start feeling the positive effect of that. The good news is it works right away. Bad news is it only works for about 2 hours. But if you have pain, and you have pain right now, like when I had my knee operation, it was something that was welcomed relief, which I needed right away. So tell me about inhalation.
Inhalation, aka vaping, also one of my favorites. This is just going to be, it's just a different way to deliver the inhalation like you would get from a smokable flower, but it's vaporized and held the cannabis into the lungs, via water molecules, avoiding absorption and potentially harmful material produced by combustion. So basically what all that says is it's, to me, it's a more discreet and more targeted form of, if you prefer smoking over the flower, and the effects on this are going to be almost immediately, and it can last anywhere from 2 to 6 hours.
Right. I know. And the key part is the vaping is delivered through water molecules. It's as opposed to if you're smoking flower directly, you're taking it. It's a lot easier on your lungs. So a lot of people worry about if you're worried about, is it going to affect my lungs or not? I know if you have a quality vaping product, you should not have any harsh feelings. You should not have any problems with it. But it is still, you're still putting something in your lungs, and so just be careful because some people may not want to do that, and that's understandable. I, for example, again, when I wake up in the morning, sometimes I can, based on how I sleep, I can end up with a level of pain of a 5, 6, maybe even an 8. And so, yes, I do take my tincture drops, but for the first 20 minutes, 30 minutes, what do? I literally, next to my little bottle of tincture drops, I have a vape pen. And I grab the vape pen and I hit the vape pen for, maybe I take 1, maybe 2 hits out of that. And literally, within a minute or 2, the pain goes away. And I have to tell you, the first time that happened, I was with my wife and I took a hit off the vape pen. And again, I was in a pain level of about an 8 at that time. And it felt like somebody took a rag and wiped my back and all the pain went away. And I looked at my wife and I said, this is scary. I mean, you got to be kidding me. I mean, the pain is just disappearing. What's going on? And what was interesting was my pain was gone, and it was gone for a couple hours. That was interesting to me then, and literally this morning when I did it, it's the same thing. I mean, it's just remarkable how fast it works. And if you have pain, I have to tell you, you know, you can find the right vaping products. It makes a big, big difference. It can help quite a bit. And you have a number of solutions for that. I know that it's in your arsenal. But you can mix and match these approaches. Like I use the vape pen to start me out on the day. Then when my tincture drops kick in, it's there. In my case, I have herniated discs in my neck. They're not going to go away. So if I have an onset time of about 6 hours for the tincture drops, and I take it, let's say at 9 o'clock in the morning, 8 o'clock or 9 o'clock in the morning, then by literally 1 or 2 o'clock in the afternoon, it's starting to wear off. So I literally have another regime where I do the same kind of thing in the middle of the day, and then I do the same kind of regime at the end of the day. Because if I don't take it, my pain will come back. And I have a pain level that I have to manage because it's a high pain level. And if I keep it that way, I have a regime 3 times a day, I keep my pain level below a 1. And that's very important to me. Important for my mobility. It's important for my attitude. Just candidly, I don't like living in pain. For my attitude, it makes a big difference. So again, it's a regime that I found works for me. Some people can take it twice a day and it works for them. In my case, I don't have that option. Now, how do I know? Because every one of the things you want to do is about every 6 to 8 weeks, you take a holiday. Stop using it for a day, maybe 2. What does that do? Your body produces endocannabinoids. And if you're supplementing it with endocannabinoids, your body can get lazy, to be blunt. Your body doesn't produce as much. It's counting on the fact those endocannabinoids are coming. You'll find that you'll have to use a little bit more cannabis to get the same relief, which you shouldn't have to. But that's just your body going, hey, my buddy's going to help me out, so I'm going to stay I'm going to just be cool here. If you take a day off, a day or 2 off, your body has to kick in and has to produce those endocannabinoids to help your body. It basically recharges your system. Now, I'm not addicted to cannabis. I can stop at any time. I don't get any night sweats. I don't have any negative reactions from taking it. What I do have is after about a day and a half, my neck taps my shoulder taps on my shoulder and says, buddy, if you don't do something pretty quick, I'm coming back and I'm going to be at a level of 7 or an 8. So I'm addicted to getting rid of my pain. I'm not addicted to cannabis. And I found a regime that really helps me be able to do that. And that's what's important. But again, every 7 and 8, every 6 or 7 weeks, I take a holiday. It helps me recharge. And when it recharges, I need less cannabis. I use less product to get the same effect. And that's what's important. Not only from the standpoint of just being able to use less product, but also it costs me less money. So that's something that's really important that's out there. Tell me about your transdermal patches. No, I'm going to change subject for a minute. Tell me about your transdermal patches. I'm a huge fan of transdermal patches. I have one on right now, by the way.
Oh yeah. Well, I don't have my own right now, but I usually have one when I'm on my long road trips. But just like you said, you got your own regime. The transdermal patches is part of mine. Like I said, it's a microdose. It lets out 0.24 milligrams every hour, and this goes over a 72-hour period. Of course, you can leave it on the whole time, or you could take it off as needed and reapply. To me, this is a good starting point for, like you said, if you got the lower back pain. I mean, it can treat shoulder areas and things like that, but this is one that's good to start out with. And if it's not enough, like you said, you could stack. Kind of like my regime I do is whenever my back's acted up, I start out with a transdermal patch. Use my vape a little bit, and then I use soft chews before bed. That's kind of where I fall at in it. But the transdermal patches, I mean, you apply it directly to the skin. It's a controlled release medication. It's delivered into the bloodstream. Like I said, with our encapsulation technology, the onset time is going to penetrate the skin and get into the bloodstream. And I'm a big fan of 1-to-1. We have a full CBD line of transdermal patches. We have a 1-to-1 and a THC. I'm a big fan of the 1-to-1. The CBD, like I said, over time feels like it gets down in to the core of the inflammation, where the low dose of THC just works well with it. Like I said, taking the patches, it's never going to get you to, even if you're new, it's not going to get you to a point where you can't function through your daily life because it's below that threshold of what you need to actually get the euphoric effect from it.
Transdermal patches, I think, I'm a huge fan, and I'm a huge fan of moved transdermal patches. That category I'm a huge fan of. what it does, you've heard the word microdosing, and we're not going to talk about much about that in this, but it just means it's like when you're on a diet, you eat maybe 5 times a day as opposed to eating 3 big meals or 2 big meals. What it does is it gives you just a little bit as your body needs it. It basically supplies the cannabis that you need, which is great. In the case in the case of move patches, what I love is they last for 72 hours. Most of the patches on the market last for 8. So I can put this on and I can keep it for 3 days. And right now, for example, I have a CBD patch on because I'm working on I'm trying to work on reducing my inflammation. And so what I'm able to do is to know that I'm getting the right amount of CBD in my body. I can just supplement it with some CBD and THC products to manage the pain. It makes things a lot easier. So my inflammation is being handled by this. As Noah mentioned, there's 1-to-1 patches, which give you a little bit of both, which is great. And again, the patch gives you the baseline, gives my body the baseline, and I don't have to worry about, did I take it this morning, did I not take it this morning? Traveling, especially, it's really good for that. But those patches work great. In the 72 hours, to be blunt, I found that your patches last sometimes as long as 4 days. So I'm not trying to oversell your product, but it's something that really is there. It's something to take a look at. The other advantage to a patch is if you're new to cannabis and you're worried about getting high and you're worried about what happens, is you can put the patch on. After 30 minutes, if you don't feel good or you're worried about it, if you take the patch off, literally after 30 minutes, it's out of your body. It's the only form of dosing that you can reverse. Every other one of them, whether it's edibles, tinctures, capsules, sprays, whatever, once it's there, it's there. You're going for the ride. You're on the roller coaster, you're on for the ride. With the patch, you can get off the ride at any point in time. And I think that's important. There are people that will put the patch on, and then at certain points of the day, they'll take it off, and for whatever reason. And again, that's up to their dosing regime and things like that. But again, patches are something everyone should consider. I think should consider, especially if you're new to cannabis, it's a great alternative that's out there. So, and then of course you have your famous flower, right?
Yes, sir. Nate, I just want to touch on the patch again real quick too, though. But just like you said, I've personally seen them, felt like it's worked over the 72-hour mark too. But, it's really good if you're new. I know we have some questions coming in about patients being new, and we'll get to those in a little bit. But this is one thing that can help new patients a lot is a patch. And you don't have to put it on your back. Just anywhere that you got, contact directly with the skin. It's going to penetrate. It's going to get in the bloodstream, and you'll feel the effects from that. Now, when you get into flower, we have multiple different types. We got sativa, indica, hybrids, like we're speaking about earlier. We also do something. It's a tiering system. We have a tier 1 through 3, where tier being the cream, the top shelf, best looking, to a tier 3, where it might not, it's still going to have the same effects, but it might not be the best presentation. It's maybe smaller size buds and things like that. Then another one I'm a real big fan of is the spray. Mm-hmm. Now, we got the spray. I'm sorry, what was that, Marc?
No, I just wanted to comment. A lot of people perceive that you buy flower and smoke it, and that's one thing you can do with it. What's fascinating is the amount of flower that's bought here in Florida that's used for other purposes. For example, like cooking. I have a magic butter machine. That's actually a machine you can use it to make your own tincture oils and things like that. I happen to use flower in the morning. I take a little, like a pea size of cannabis, and I put it in my coffee. And why do I do that? It's because the coffee is not hot enough to trigger the delta 9 THC, so I'm not going to get high. But the coffee is hot enough to trigger the THCA and CBDA. And if you go back to that wheel, you'll see those are the anti-inflammatories and the pain relief molecules that are in the CBD wheel. So by just dropping a little bit about that in there, it basically is an instant pain relief for me in the morning. I've been able to actually replace my tincture drops by being able to do that. And then when I'm done, I actually eat the flower. I kind of chew it like gum, and it basically helps a lot. I found it to be more effective than a lot of the tincture drops that I've taken. And again, it's because the heat level doesn't trigger the delta 9. It only triggers the THCA and CBDA. It's kind of an old, I guess that's an old practitioner's trick. but it's something to really take a look at. So flower is not just for smoking. You can, the edible forms are really good. Some people make their own gummies, for example. It's there. So
I got to remember that coffee trick. I might have to try that. That sounds
it works
sounds
great.
like that worked pretty good.
It works great. I learned it from a practitioner a while ago, and I have to thank her very much for that. But tell me about the sprays, because sprays are very interesting. It was originally developed for children who had epileptic seizures, and they wanted to be able to get the cannabis to them. But it's actually been used by a little bit more for people now.
Exactly. The sprays are going to be, another beginner-friendly type option where one spray is going to equal 1.9 milligrams per spray. So you're still under that, 3 to 4 milligram threshold to actually start feeling the euphoric effects off of it. And once again, your onset time is going to be 15 to 20 minutes, and the duration of the effects are going to be 4 to 6 hours.
Sure. Now, the last one is suppositories, which I'll take that one. Why do they do that? It's because a lot of people who have GI tracts, a lot of the lower part of your body, your middle part of your body where you have some issues, the closer you get the cannabis to it, the more it helps. And that's what it was developed for. It absorbs, especially into those areas. Again, if you have Crohn's disease, if people have pelvic cancer, I know that it may sound crazy, but some people that have been diagnosed with different things that have to do with your plumbing, then it's one of the best things that are out there, and that's what it's there for. What I want to do right now, if you don't mind, Noah, is we've got some questions that have been asked. Why don't we answer some? So we'll kind of run through it. I'm going to
grab my mind. I was actually just looking at a few of them right now.
I'm going to take one that's really quick. I mean, Christine asked the question: Is CBN not part of the wheel? The answer is yes. Again, let me go back to the fact that there are 108 components to CBD and marijuana. There's 450 different in the cannabis plant. That wheel just didn't have CBN on it, but the answer is yes, it does. And I'm trying to find an up-to-date CBD wheel that has a number of other things in there, like CBD, CBN, and that type of thing. But the answer to your question is yes, it is. It's part of the CBD wheel. You want to take one? Noah?
Sure. I got a question here from Victoria. She said, my PTSD makes my anxiety high. Does a hybrid work better for that? Me personally, I get anxiety too. It depends on the hybrid itself. Typically, when you have anxiety, you want to stay away from the strong sativa products, and from my experience, because sometimes it can trigger the anxiety. You want to stick to more indica or indica dominant hybrids.
Yeah, with PTS, typically the best thing to do is really two things. One is you want to chill out. So pay attention to, excuse me, the indica products will help you much better than the sativa products. And the other one is, we talked about terpenes. Stay away from pining, okay? Pining is great to help you with your memory, all right? But in the case of PTS, you have a situation where you don't necessarily want to bring back a lot of those memories. You're not trying to suppress them. You just don't want to relive them all the time. So I would look, when you're talking, especially if you have PTS or even depression, talk to your bud tender and make sure that you don't have a product that has some pinene in it. Again, these are pluses and minuses for each of these, but it's something that can really help you that's out there. But the answer is yes. Stick to some, as Noah said, stick to the indica side, and it'll help you quite a bit. Noah, you want to take another one? Or you want me to grab one? Let me grab one. Victoria asked, does it help with fibromyalgia? And the answer is yes, it does. Now we're going to do next week a webinar on multiple sclerosis, MS. We will address some fibromyalgia in that webinar. And a lot of the remedies that are used for MS also help with fibromyalgia. But the answer is yes, it does. It helps with the relief. If you can just think about the process that if you can relieve the inflammation, it helps relieve the pain. And then also a lot of the components of medical cannabis, one of the things it does is it's what they call a builder. The CBD modules and THC modules work with your body to be able to rebuild your a lot of parts of your body that makes better. Now, it doesn't make fibromyalgia go away. I don't want to give you the impression it's a cure, but I will indicate that it's very well known. In fact, it's better for fibromyalgia than a lot of the drugs that are out there to be able to relieve pain. and be able to relieve the inflammation and basically help you get your mobility back. And I say that because my mother has fibromyalgia, and we put her on a regime over a year ago, and the Energizer Bunny is back. Let's put it that way. You want to take?
I got one here from Susan. Will tropical medical marijuana help ease pain in knee that is bone on bone and needs replacement? Now, once again, you have to consult your doctor on it. But from coming from somebody who is, I haven't had full knee replacements, but I've had 2 ACL replacements and half my MCLs. Our Evolve gel, the one that has the encapsulation technology, it really does help with my knee issues. Like I got a 6-year-old, if I'm ever running around trying to catch up with him half the time and it starts acting up, like it starts like just shooting up my leg, I will use the gel, and it will actually get in there and relieve that pain. Now mine's a little different. It's not bone on bone, so I'm not sure how much it will relieve that pain, but it definitely will help.
In my particular case, the reason I've had both my knees replaced, left and right knee. I had my left knee done about 4 years ago. I had my right knee done actually about 12 years ago, and I actually had it done 22 years ago. That's how bad it was. Why? I was a golfer. I walked golf courses, playing anywhere between 12 to 54 holes a day out in the sunshine. You tend to beat your knees up. But what's interesting is I had bone on bone, and I did use topicals for quite a while to put off the surgeries. And why did I put the surgeries off? Especially 10 years ago, they didn't have the technology in knee replacements that they do today. I can say now I wouldn't fear getting a knee replacement after my last operation, but before that, it was more of a traumatic experience. But the answer to your question is yes, it will. What you're really trying to reduce when you're going after bone on bone is you're trying to reduce the irritation, aka the inflammation. And if you can be able to get, again, on a regime that's high CBD but has some THC in it, it'll give you the inflammation reduction and also help you with the pain. So it's not going to get rid of the problem. It'll make it livable. Okay, let's put it that way. I hope that explains that particular question. There was one, I'll grab a quick one. So an anonymous question asked, does the flower, would it be good for back pain? That's what I use it for. And I would say absolutely. Yes. I'm going to have a case study of one. That's me. And I got it from a practitioner who works with a number of people. The answer is yes. But again, it's about a pea size of cannabis. You're not taking a big bud, you're taking a pea size. Drop it in there when the brewer, just drop it in there. Let it sit there for about a minute. I put cream in my coffee. I drink that. And then at the end of it, I eat the bud. And the answer is yes, it does. It helps quite a bit. So give it a shot. Again, every person's different. Every body is different. I tend to use an indica. I've tried an indica and I've tried a sativa. I find the indica works a little bit better in the coffee than the sativa. Just as I should be using the sativa in the morning to get that energy. But I found for me the indica works a little bit better. Again, it's totally up to everybody. You want to take one? You want to take one, Noah?
Sure. Yeah, I just want to comment on that too. A little sativa with coffee with the caffeine. Whew, be ready to put in some work.
Be very careful. Be very, very careful. Yes.
Yeah. All right. See here, Judy. She asks, can some transdermal patches be cut into pieces? Yes, they can, but with the transdermal patch being a microdose, you generally don't need to cut it into pieces because it's a dose. It's under a threshold where, like I said, you're not going to get the euphoric effect. So if you're worried about like it being too much as a whole patch, then I wouldn't worry about cutting it or anything like that. Like I said, the patches are a good baseline, and because it's just going to let out 0.24 milligrams per hour. So like I said, you usually got to get around the 4 milligram range for most people to actually feel the euphoric effects. So, yes and no. You can cut them if you need to, but you really don't need to because the way we designed them is to be a microdose, so you don't have to worry about, the euphoric effects and things like that. It's just going to give you that small dose all throughout the day for 72 hours.
So the answer basically is you really don't have to. I mean, they're self-regulating. So if you're trying to cut down on the amount of dosing, I do know people that do cut the patches because of where they place it on their body. Okay, I know that, and to be blunt, my wife was worried about when she wears dresses. I put one in the middle of my back because that's where I have a problem. Actually, just below my neck. Um, and she, when she wears dresses, she has to worry about whether they can see the patch or can't see the patch. So the answer is yes. You want to put it on a place where you have a lot of what I call a lot of tissues that have blood cells in there inside of your leg, and your arm, middle of the back, things like that. But again, for cosmetic reasons, you may want to be able to do that as well. Not necessary, but something you can. Yeah, and you can do it. Okay, and the answer is yes. Just may not be practical, but you can do that. There's one question that I'm going to grab here. Can medical marijuana, can you use medical marijuana in low dose antidepressants? And the answer is yes, you can. The only thing that you have to worry about with medical cannabis is if you're on some sort of a blood thinner, like warfarin or things like that. If you're doing that, you can take medical cannabis. But what we do is we have your medical marijuana doctor talk to your medical doctor so we can make sure you get your dosing correct for that. Okay, we don't want to create a problem. You can use blood thinners and you can use medical cannabis, but again, we have to be very careful about how to do that. And I just recommend getting doctors involved. As far as antidepressants, the answer is yes, they can be used. Again, I know people that have been on antidepressants. They start using medical cannabis, and to be blunt, after a while, they forget the antidepressants because, again, it helps them with their mood, helps them with their appetite, helps them with their overall effect. It's something that's there, but again, it's going to be up to you. The answer is yes, and make sure you consult your medical marijuana doctor and your practitioners. A little note on that, okay? Most medical marijuana doctors, and I'm going to defend them, are just getting into the business and aren't necessarily cannabis practitioners. And there's a difference between someone who's a cannabis practitioner and somebody who's a medical doctor. Medical doctors they know their medicine, but as far as how cannabis works on the body, they aren't necessarily. There's no classes that they take. There's nothing in their degree, and the state doesn't require them to take any training on cannabis. They have to kind of learn it on their own, and that's what they're trying to do. And so, really, people like Noah go educate the doctors, and that's one of the important functions that you perform. But I work with a group called Medical Marijuana Treatment Clinics, MMTC of Florida, and I work with a lot of doctors. I have a doctor referral network. I have a medical marijuana doctor referral network. I work with a lot of doctors. Why do I refer doctors to MMTC or people that are in our network? Because we have a dosing center. Part of getting your card from MMTC is you get access to a dosing center. So what happens is that once you visit your doctor and you get your card, you can go into the dispensary. The med tenders will help you be able to figure out which products for that particular dispensary to use. If there's any question that you have, you can call the MMTC call center. And if you just, in general, you can call the call center to get advice on your dosing to help you be able to get that right. And in fact, this summer, we're going to be introducing a whole dosing program for that particular area because we've had so many people need that help. But that's why I use MMTC. It's an additional benefit. They're more than just the card. The card is good, but unless you have the dosing right, it's not going to really not going to land that bird as far as being able to get to the place you want to be to help you with what's out there. So I know that's one of the things. I'm not being negative to medical marijuana doctors. All I'm saying is their problem is education, and it's something that's lacking, and that's what we're trying to fill the gap. But there's a center to be able to do that, and that's what MMTC does. Now, if you're a person who is you have a medical marijuana doctor, and he doesn't quite know he doesn't quite have all the answers for dosing, you can switch over to MMTC for $49, and you can now become part of that network and get dosing support. So there is something out there to be able to help you. And I think there was a question on here about one of the anonymous questions was about again, it was from Linda. Linda was mentioning the physician. How do I find a physician that makes recommendations regarding strains and properties? Again, that's what MMTC. That's why I work with MMTC, because few doctors know much about medical cannabis, and unfortunately, that's where our industry is. We're still catching up from an educational standpoint. And again, I'm not being negative to the doctors. What I'm trying to do is we're trying to get the education out to the doctors so they can be able to help that. I know I had a doctor, a couple of doctors that literally said, well, you know more than I do, and my answer was yes. I took a 2.5-year degree and studied from some of the best cannabis practitioners that I know, not just in the United States, but in the world. I deal with a lot of the Israelis. The answer is yes, there's more to this than just a 13-hour course, let's put it that way. But it's something it's very much of a healing medicine. It's not necessarily something that you just throw that's out there. So again, I hope I gave you a solution, Linda, and I hope I gave you some direction, and I totally agree with you. Finding a doctor is hard. That's why MMTC has a dosing center, and pay attention to the fact we'll bring out a dosing product this summer for you. Why don't you take one? Is THCA good for pain? You want to take that one, Noah?
Actually, let me catch this one right down below you real quick. It's anonymous. They asked, what dosage do you suggest for a sublingual tincture? I've smoked marijuana on a daily basis and have a tolerance. So that's a good question. So you smoked on a daily basis. The tincture is going to be more of a concentrated dose. So once again, it depends on how much tolerance you built up smoking every day. If you go to our encapsulated tincture, you're going to have that. That's a good way to find out where you're at, because it has encapsulation technology. It has an onset time of 10 to 15 minutes, opposed to where a lot of other tinctures you're looking at, anywhere from 20 to 30, sometimes 45 minutes onset time. But if and once again, we have a full range of products. You have 1-to-1, a full THC product, and we also have, if it's severe pain, like I said, your tolerance is real high, we do have an RSO line, which is more potent, and you're going to get more milligrams per drop than you with the regular tinctures. Sure. So once again, that question right there, if you've been using it on you're smoking it on a daily basis, generally most flower has anywhere between 12 and 17-18% THC in it. When you get these tinctures, it's going to be a lot higher concentrated dose, so it could probably help. Actually, you'll see the difference. You can cut back smoking. You might not have to smoke all day, opposed to just trying to tincture a couple times a day.
And you mentioned RSO. RSO is interesting. It's a tincture oil. It stands for Rick Simpson oil. And Rick Simpson came up with a formula of being able to take the whole plant and be able to produce a tincture oil for it. So it's a whole plant tincture oil, as opposed to just a cannabinoid strain that's out there. Very, very good for you. But being a whole plant strain, especially if you get a sativa type, it will be just like smoking cannabis. So be very careful about how much you take. It is extremely effective for cancer, for example. I put my mother on it. She was diagnosed with cancer 8 years ago. I put her on it, and what we did is because you do get euphoric effects. I had her take it at 10 o'clock at night. She slept like a baby. She did have a little grogginess in the morning, but it was very effective for her. 4 years ago, she's still alive, okay, and doing well, maybe too well. The Energizer Bunny has been awoken, but I'm just saying it's now she's 92 years old now. She got it when she was 88. Now I'm trying to point out that it is a whole plant product, and again, we manage ourselves so she takes it at night. She's not driving. She kind of enjoys the evening. Let's put it that way. Be very careful about using RSO oils, but they are extremely effective and they are very useful. Again, I would attribute the fact that my mother is still on the side of the grass because of it. And that's a whole plant product that you won't find in your normal tincture.
And that's exactly why I got in the industry right there, Marc. Just hearing, feedback like that it's helped so much. I mean, that's what keeps me going. I want to answer this real quick from Judith here too. She says, can you name some varieties that have the terpene linalool in it? Yes, of course. Linalool is going to be actually in some of our more popular products, like Pineapple Express, Headband, OG Kush, Banana Hammock, Canasu, Velvet Glove, Fire OG, Maui Wowie. A lot of these are a lot of the real popular strains that we have, and they all have the linalool in there.
I should point out two things. Move gives, you can call up Move and you can schedule a consulting appointment and it's free. Okay. And so if you have some questions about their products and what has linalool in it, what doesn't, what would be good for you, call them up. they will do not only just an in-dispensary visit, but also you'll be able to do it and get it through a telemedicine type of approach. They'll be able to help you ask a lot of those questions and answer some of those questions and get right down to the actual products themselves. So that can help you quite a bit with that. I'm going to take one right up here. I had one. Are there any complications of using a transdermal patch if I take medications for high blood pressure? And the answer is yes. And that goes back to being very careful about what you're doing with blood pressure medicines and medical cannabis. If you're using medical cannabis in low doses, the answer is you don't have a lot of problems. If you're using in higher doses, you can. I would say please consult your medical marijuana doctor and please consult your medical doctor. Now, what happens if your medical doctor is opposed to cannabis and doesn't want to deal in that party? To be blunt, find one that does. 4 years ago, it was hard to find a doctor that would even want to consider cannabis. Today, it's becoming very popular for doctors to understand that cannabis is part of the, let's just say, the medical regime that a lot of people take a look at. But the answer is there can be complications, especially if you're taking the THC patch. Okay, so I would just say recommended anytime you have to do blood pressure, please get your doctor. You have a team. You have a medical doctor, a cannabis doctor, and you have yourself, and you have the dispensary. Okay, you have the bud tenders that will help you. This is where going to the consulting group getting some consulting from Move. They'll help you work through those particular issues and get the right people, line the right people up. Is that right, Noah?
Yes, sir. And
that's free. By the way, it doesn't cost you any money.
Yes, we have a consultation room at every dispensary. It's private. You can sit down one-on-one, ask as many questions as you like. Our bud tenders will go into, med tenders will go into detail of each one. And it probably actually could help Rhonda too. She says she's been told that she's rare, that indica and sativa work the opposite for me. And wonder if we talk a little bit about that. That probably is going to get into the different terpene profiles that we're talking about. Sativa, indica, depending on which terpene profile that type of sativa or indica has, it could have a different effect. And then, everybody's body is different. You may just indica may actually lift you up, and sativa may bring you down. But I would suggest that was more into the terpene profile of how it's interacting with your body.
I think that's a good answer. I mean, I've run into that a couple times with a couple of patients that have that particular issue, and it is a bit rare, but not as rare as you think, where it has opposite effects. And again, I'm going back to the fact that every body is different. Your metabolism is different from someone else. So that's something to just adjust to. But as you're taking again, start with a 1-on-1 0.25 milliliters, take it for 4 or 5 days, figure out how it works, then go up maybe 0.5, see how that works after 4 or 5 days, go to 0.75. And then what you do is if you drop down on the THC level, you start getting your euphoric effect, and you drop down to THC level, that should go away. But in your case, it won't. You'll have to drop down to CBD level. So you'll be able to find, and that's where you hear about what they call ratio product. Is it 1 to 4? 1 THC to 4 CBD. What are all those about? What I love about the Move products is you really don't have a lot of ratio of products. You have CBD and you have THC, and the patient can be able to mix those products together to be able to get the right formula that's out there. So a lot of companies, you have to buy 4 or 5 different bottles of things to be able to figure it out. Move makes it very simple. If you have a THC product, you have a CBD product, start with a 1-on-1, and then as you need to be able to complement the CBD and THC, you can do that to find your sweet spot. Makes it much easier.
I like the way you said that's exactly why we did it and what's the purpose behind it. Because especially when I was out in California, you'll see 16 to 1, 1 to 16, all kinds of different ratios is the next best thing. That's the way they pitch it. But really, it's your body and how it reacts, and that's why we do a CBD, a 1-to-1, and then a full THC. Like I said, just like Marc said, start out with a 1-to-1. If you're feeling like it's a little too much THC, you can add a couple of drops of CBD to counterbalance that, and then you'll turn that 1-to-1 into a 4-to-1. Sure. Or vice versa, if you need to up it a little bit on the THC side, you can add that in, and then it can become instead of a 4-to-1, it can become a 1-to-4 if you're going to use the same acronym there. But yeah, just it's all about. I've seen 16 to 1s, 4-to-1s, 12-to-1s.
My mother takes a 20-to-1 in the morning.
One and then kind of works from
CBD
there.
to 1 THC to give her during the day. In the evening, she has an RSO oil. My wife uses one that's basically a 12-to-1, 12 CBD to 1 CBD to 1 THC, 12 CBD to 1 THC. She's very susceptible to THC, and it works very well for her. So again, it just depends. That's it. Finding your sweet spot is the most important thing that's out there. One anonymous question says that I hear you say you take your tincture before you get out of bed in the morning. Well, not before, but right after I get out of bed. I kind of get out of bed and I take it. I don't take it in bed. It's right there on the nightstand, and the answer is yes. I have a morning regime, I have a midday regime, and I have an evening regime. And I'm going to go back to the question about CBD and THC working opposites. There are products that are made to be able to help you relax and sleep. And I've seen variations of that product that actually energize you. And the difference, as Noah mentioned, is the terpene profiles. So pay attention to not only the CBD and THC products, but also check out the terpene profiles of the products that you're using. They might be the key to why you're having the problem that's there. There's a good chance of that, okay? Not saying it isn't, but it's something you might want to take a look at. I think Noah kind of pointed you in the right direction. And again, talk to your medical cannabis doctor, or talk to your bud tenders, and they'll be able to get you into the right levels that are there. Last question that I see here is, what is a good variety for fibromyalgia? Do you have an answer for that? I have a slide on that, but off the top of my head, I can't answer that. Maria, I'd be more than happy to send that to you and include it in the notes. Do you have an answer, Noah, potentially?
Now, off the top of my head, is borderline like make a recommendation. We'll get back with you on that one.
Yeah, I would say, but the rule of thumb for fibromyalgia is the high CBD, low THC products help quite a bit. And I know it's counterintuitive. A lot of people say, well, because it's pain, you want to have high CBD, high THC, and low CBD. What's interesting is if your pain is coming from the inflammation, if you get rid of the inflammation, you get rid of the pain. If you just douse it with THC, you do get rid of the pain, but you just mask a lot of the pain, but it's not getting rid of it. And I found that out with my knee surgery. Right after the surgery, I was using high THC, low CBD concentrations because I thought that's what I needed for my pain. And I was running low on THC one day, and I reversed it and found out it worked better than the high CBD THC side because my problem was inflammation after the surgery. My knee was swollen. When the swelling went down, my pain went down. And I know it sounds simple now, but at the time it was a revelation. Let's put it that way.
No, just like we talked about, to me, the CBD acts as a more long-term fix because it gets down to the root of the problem, and the THC acts more of an immediate pain relief because it just blocks it off. So I definitely
you have some Move products that are pretty cool. We've talked about, we can talk a lot about the formulas, but you really have Move has a very wide variety of products. I think this is what's important. There's a perception that people go smoke cannabis. I know of some people do, but a lot of the medical marijuana patients that I work with don't smoke flower. Best way of putting it. And you've got quite a selection there: ingestibles, transdermals, smoke, as well as smokables, right?
Yes, sir. We have a product to fit your need. Me personally, I used to lean more towards flower and to having. My son's 6 now. Like I said, to me, it's more, being more discreet. And when it comes to anxiety, we have a meter dose inhaler that has been a lifesaver to me. It's just like an asthmatic inhaler. If my anxiety, I start feeling it, you start feeling it get tight in your chest.
Right.
It's real discreet. One pump gives you 2.4 milligrams, and to me, it's just enough just to settle me down. It's not enough to kind of like I said, get the big euphoric effect. If you do a couple pumps in a row, yes, but that one pump is just enough just to kind of calm me down. I mean, we're at his birthday party at a jump place. They have all the trampolines. There's 26-year-olds running around, and it only took about 45 minutes of that. And I was like, whew, the anxiety started acting up. I stepped out, simple pump, waited a couple of minutes, went back in, and I was good to go.
Yeah, and the thing about that metered inhaler is it helps you with your dosing.
Mm-hmm.
Now, I do want to point out one thing. I kind of skipped over real quick. one of the reasons why I like Move, and one of the advantages of your product line is what they call your transdermal technology, your encapsulated transdermal technology, where the products that you have go right through your derma and go right into your bloodstream, which normal products don't do. You want to explain that just for a second?
Of course, what we did is we came out what we call our Evolve line. It's encapsulation technology. It basically makes it water soluble, so it can bypass the skin and get actually into the bloodstream. Whereas your normal tropicals, they're not water soluble, and they're not going to be able to bypass and get into the bloodstream. That's why it'd be more of a localized effect. Where our Evolve, the encapsulation, anything that you see that says Evolve or encapsulation technology with us, just remember that will penetrate and get into the bloodstream. So you are going to get, the full effects of that treatment. So I just say that because, I've had a patient before that went to another place and got tropicals and it didn't have that encapsulation, and they came and got ours with the Evolve, and they put a little too much on. So, I mean, it will get through the bloodstream, and, you get the full body effects of it. That is something that we actually have a few patents approved and a couple more pending on. But really, really great technology there where, like I said, once again, to me, that Evolve gel is a lifesaver when it comes to my knee.
One of the things I like about your Evolve gel is we did 135 seminars live before we started doing webinars. Thank you, COVID-19. But what's interesting is when I was traveling, I was able to take a transdermal gel. I was able to put some on the inside of my arm here, and basically that was how I was able to use my dosing for medical cannabis, and it was very easy. It's easy to carry around. It's about the size of a capsule of Blistex. You're familiar with chapstick with Blistex? It's about that size. Very handy and very easy to travel around with, and very effective. So it's something that you may want to take a look at. But that encapsulated technology is really an advantage that Move has over a lot of its competitors. So, and you have a wide range of products. I mean, you got the Wana gummies, you got some chocolates that are out there, right?
Oh yeah, that's something that they just approved here not too long ago here in Florida. Is the soft chews. We teamed up with Wana here. We have a sativa line, a hybrid, indica, and we also have a 1-to-1. Me personally, each one of the soft chews is 10 milligrams per soft chew. Once again, like Marc said, it's all about finding your own regimen. I found out quick that 10 milligrams I took before bed. I slept like a baby, but I woke up next day feeling kind of groggy. So what I did is I cut it in half. I take 5 milligrams before bed, and then now that's my regimen. Before bed, I take it about an hour before bed, give it plenty of time to kick in, and watch whatever show I'm watching to go lay down. Now the chocolates, that's something we just actually rolled out a couple months ago. They're great. We're working the same sense as the soft chews as far as dosing and the effects. We have the different strains in them also, and then let's see what else we covered. We covered the tincture.
You covered the tincture oils. Tincture oils I like because you have a nice minty flavor with them, and the sports gels work really great. It's something that's out there.
Now, as far as the if you see here in the bottom right, the RSO encapsulation. Now these are going to be stronger than our normal capsules. Our normal capsules are going to have 10 milligrams, where the RSO ones are 30 milligrams per capsule. So that's something else to keep in mind. Where the question was earlier, where the anonymous question, where they were saying they smoke every day for their whole life. If you're a heavy cannabis user and you have been your whole life, I mean, looking into something like the RSO capsules or something like that may benefit. To me personally, it's too much. It's too many milligrams for me. But once again, your body's different. You just have to find where your tolerance level is. If you're a beginner, you're new to this, I would not recommend going towards the RSO capsules. Start out with your patches, even the soft chews. Don't take a whole one to start with. Try half of one, see how that works for you, and kind of work your way up. Just like Marc said, the only thing that you can take away is the patch. Anything else, you're in it for the ride.
Now, RSO is great. Why did I start my mom on RSO? Because she had cancer. And they basically said, you got to, the clock is ticking. So it wasn't a matter of us taking a whole lot of time and figuring it out. So, and we talked about it ahead of time, and she knew she'd get an euphoric effect. So she substituted this for her evening brandy. Let's put it that way. And it turned out when she got used to it, it was something that was very tolerable. But just be careful because it is there. You have to manage that. But let's talk a little bit about. You also have something called strain print. This basically, strain print basically helps you kind of figure out what not only what you should take, but reminds you what you can take. Helps you keep a journal and tells you what other people are experienced with that particular product, right?
Oh yeah, I'm a big fan of strain print. Any of the doctors I talk to, often ask them to ask their patients to get on this. And it's not just Move. All of our competitors, they use it too. And just like Marc said, it's a cannabis journal. Not only are you keeping a log of what you're doing, you can help somebody that's starting out with a similar situation and getting into it like you can maybe help them skip a couple of steps, and your regimen might work for them. But the biggest thing is it helps you keep track of what you're doing. You can try to memorize it all you want. You're gonna, you'll forget it. It's like it's a cannabis journal. Keep up with it. And actually, Washington State University actually pulled and did a study out of data just from strain print, where it showed that it reduced symptoms of OCD, and I want to say it was 68% of the participants. Don't quote me on that. I know it was in the 60s, but I want to say it was 68% just from the data from here. So I mean, it's a very good, easy to use.
And journaling is important because you'll find that when you take cannabis on an empty stomach and you take cannabis after you've eaten, there's a difference. Cannabis loves fat. It loves food material. It works better when you've had a little bit to eat. For example, I have a little bowl of Cheerios in the morning, and it works great with that. When I don't have as much Cheerios, my little bud in the coffee doesn't work as well as when I do have the Cheerios. So you will find, and I journal. I keep track of what happens when I take it, so I know what effects it'll have for me. And I've been at this now for I've been almost 5 years now in medical cannabis, so I've got a little scar tissue in that area. But it does help, and strain print really does help with the journaling. It's out there. Now let's talk about where do we find you? You're in a lot of locations, right?
Yes, sir. You can get us you can find a dispensary anywhere from Northeast Jacksonville, Florida, all the way down to the Keys. And we are expanding more and more week by week. So you'll just see more and more locations popping up near you soon.
Right. And more importantly, you have discounts, right?
Yes, sir. You got your first time patient discounts, veterans, senior citizens, which I kind of hinted to where I might be still a little too young for earlier. And then one of the biggest things is too, when you talk to your doctor, ask them for one of our physician referral cards. Now these could be used. You can't stack these.
That's the thing on the right here. When you're working with a medical marijuana doctor, they'll give you a physician referral card.
Exactly, and you can see the huge savings you get there. You get 25% off your first visit, $75 off of a purchase of 150 or more in your second, and then a buy one get one of your choice on your third visit.
Right. So there are some discounts that are out there that can help you. If being able to buy the product is a problem, get the consulting and talk to Move. They'll work with you. But
yeah, we even do a patient referral program where if you refer a friend, you get 20% off just by doing that too.
Sure. Cool. So that's basically. You also deliver, and you can order by phone. You can order online as well as by phone.
Of course, yes, sir. You can give us a call or just go to moveflorida.com, shop, look up what you like, make the selection, and we'll deliver within a 20-mile radius of that dispensary. Depending on the capacity that day, the traffic, they may work with you if you're a little outside that range, but generally we try to stay within that 20-mile radius.
I know that I'm outside of that, but they do deliver because I'm right off the freeway or on the highway that's out there. And it's easy. I can place my online order. I know what I want, and I don't have to go driving downtown Orlando. They deliver it that's out here. So it works very, very handy. And by the way, they come in nondescript cars. I think a lot of people are worried about somebody showing up with marijuana leaves on the car and all that stuff, and your neighbors are seeing that you're into cannabis. They're just very nondescript white or blue cars, and they're very safe. So you'll be very discreet as to what's there. It's more discreet than Amazon. Let's put it that way.
Hey, exactly. And a lot of that too is, the Florida regulations. I mean, we can't have, advertisements or anything. So it's just going to be, a normal car that they're going to pull up to you, discreet packaging, then deliver it directly to you.
Sure. Well, listen, Noah, we've covered a lot of subjects. We've answered a lot of questions. We've kept people here for almost 2 hours. And by the way, I want to thank everybody who's still with us. Thank you very much. We know it's a long webinar, but we cover a lot of subjects, answer a lot of questions. And I want to thank everybody for doing that. We're here to answer your questions and to help. You will get an email after this. We'll give you a copy of the video of the webinar, give you a copy of the presentation, a lot of the notes that are out there. And again, thank you. Noah, you have any last minute questions or comments you want to make?
No, just basically any questions you have. If you're new to the industry, don't hesitate to ask. I mean, everybody in this industry is very welcoming. Everybody's been in your shoes before they've got to where they're at now. I mean, I was once a first-time patient myself. I come from originally from small town Alabama, where it's still considered the devil's lettuce. Which they actually are looking to pass it next year, but it's just give it a shot. I mean, I wasn't 100% sold on the benefits of it in the beginning until I actually saw it work firsthand, and then I tried it myself. And then once I started, dialing in my regimen, just like Marc said, day-to-day basis, I don't take any of my other medications that I used to take before this. All I do is have my cannabis regimen. I mean, it really is there. It's been around thousands of years. It's there. Just always remember, consult your doctor, talk with the med tenders, start low, and then just kind of work your way up. And then just be patient. Marc said it took him up to a month. It took me a little longer than a month just to dial mine in. Well, the pain, I dialed in a little quicker. Mine was more the anxiety, trying to dial that in. But that's where the meter dose inhaler came in. But, just like I said, just, give it a shot. I guarantee you that it's going to help. It's going to benefit you in some way, whether it's going to be, your overall just health, well-being, targeted pain areas, mood, whatever it may be. Talk to your doctor. After you talk to your doctor, come to us, and we'll get you going in the right direction.
Well, listen, thank you, Noah. I appreciate it. And by the way, thank you and Moo for sponsoring this particular webinar. As usual, you did a great job. And I want to thank again everybody who's basically hung in there for the 2 hours. This is important. I know this is something that personally, my goal is to really help people get their lives back. And that's what I'm really trying to strive for. And if I can just get one person to get their life back from this webinar, we've been successful. If you have any questions, you can send me an email. The event or events@marijuanaaware.com comes to me. I'll be able to answer those. You'll find that we will publish. We have a schedule. We have MS, multiple sclerosis next week, and ketamine the week after. We're going to be publishing a schedule for over the summer. We'll be having some webinars then. Some of them will be rebroadcast. Some of them will be live. And then again, we're going to go full live seminars starting again in the fall. And we'll publish the whole schedule for the rest of the year, probably in the next 2 weeks. But I do want to thank everybody. I know it's important. And again, it's your body. And last thing I can tell everybody is just for you to understand, no one's ever died from using medical cannabis. People have died from using pharma drugs. And I'm not trying to trash the pharma industry. All I'm simply saying is when you're looking for alternatives, and especially in the case of pain, don't end up in a situation where you're in a hole where you're getting addicted to something and it's very hard to get off it. Put yourself down a path that's good for you. And I know this is a bit holistic, but it's probably what's best for you. Anyway, thank you, Noah. Thank you, everyone, for attending. Thank you, Lenny. A shout out for these are moderators in the background who helped us quite a bit. Thank you, and everybody have a great weekend, and hopefully we'll see you next week for MS. Thank you very much.
Sounds good, Marc. Thank you. You have a great day.